Sam Calacino, and this is a presentation on the effects of foam rolling on delayed onset muscle soreness. So, as a background, delayed onset muscle soreness, otherwise known as DOMS, is the rigid and sore feeling in the muscles after completing unaccustomed strenuous exercise. DOMS can last anywhere between 3 to 5 days, give or take, also depending on the type of exercise done, how hard the exercise was, and also can depend on how hard the athlete pushed themselves. DOMS can also vary depending on techniques used before and after exercise by the athlete to prevent the severity of DOMS. Foam rolling is used as a recovery modality after intense exercise to help alleviate muscle soreness and fatigue. So, DOMS occurs during eccentric contractions, or rather after, but eccentric contractions is a lengthening of the muscle, leads to microscopic muscle damage during exercise, and releases inflammatory mediators. An accumulation of histamines and hydrogen ions can cause the sore and stiffness feeling in the muscles. It can also cause edema within the damaged muscle. Foam rolling is a self-massage with the use of a foam cylinder, which is the orange object in the picture. It's intended for a self-myofascial release technique. Its indications for foam rolling are to relieve muscle tension, fatigue, soreness, inflammation, and it could also stretch out the muscles. It can also aid in increasing range of motion and improve flexibility. So some contraindications for foam rolling are immediate injuries like muscle strains, fractures, things like that, any stage of neuropathy, pregnancy, diabetes, hypertension, osteoporosis, and arthritis. So Article 1, its purpose was to compare the different types of recovery modalities on DOMS. The different types they offered were active recovery, cooling, massage, compression garments, e-stim, stretching, immersion, and cryotherapy. They were all searched across different search engines. Different reviews were also searched to be evaluated in terms of effectiveness in treating DOMS. The results found that active recovery, massage, compression garments, immersion, and cryotherapy only showed a partial change in DOMS. However, massage was determined to be the most significant technique in reducing DOMS. Article 2. The purpose of this article was to understand the mechanisms of the molecular level during DOMS. Muscle damage and the inflammatory responses were observed after eccentric exercise. The participants performed calf raises on their right leg and performed 10 sets of 40 reps. To calculate the different inflammatory mediators, blood and urine samples were collected before exercise and then 2, 4, 24, 48, 72, and 96 hours post-exercise. These samples were then analyzed for multiple different inflammatory mediators. Neutrophils were the most abundant mediators found. They circulated and migrated to the muscles that were involved with the eccentric exercise, therefore being involved with muscle damage and the effect of DOMS. Article 3. The purpose of this article was to showcase the effects of foam rolling to help in the recovery of muscle fatigue and soreness. Power, pressure pain threshold, sprint speed, change of direction speed, and dynamic strength endurance were also reviewed after foam rolling. The participants performed a 10 set of 10 reps squat exercise, followed by 20 minutes of foam rolling each muscle group of the lower extremity. The main results show that foam rolling improved recovery from DOMS and also muscle tenderness. Foam rolling also increased the pressure pain threshold, sprint speed, power, and dynamic strength endurance. It's concluded that massage can help with pain due to DOMS. However, more research is needed on if massage can improve muscle function after experiencing DOMS. Also, foam rolling is an affordable and easy modality that can alleviate muscle soreness. So, for my clinical judgment, I would not be opposed to using foam rolling in a clinical setting because it can be useful and self-efficient for an athlete to treat themselves and is also successful in its treatment. Foam rolling can be used for 20 minutes before and after exercise if needed. Patient positioning can also vary depending on the muscle they intend to foam roll. For example, if they were to do their hamstrings, the patients would be sitting upright with the foam roller centered in the center of their hamstring. That way when they place their body weight on the foam roll and they're moving forward and backwards, they can get the whole length of the hamstring. So in conclusion, delayed onset muscle soreness can occur after strenuous and unadapted exercise. Therefore, recovery modalities can help reduce the negative effects of DOMS. Foam rolling has been shown from Article 1 and 2 that it can significantly reduce the tenderness and pain produced by DOMS. However, more research is needed again to determine the effects of foam rolling has on muscular function. And these are my references, and thank you for watching.